Okay, hi everyone. My name is Zachary Gersten, and I'm the technical manager for this session on political and economic dynamics of nutrition and health. And the session is chaired by Carol Levin. Thank you all for taking part in this ANH Academy week, and we look forward to a robust and interactive session today. Just a quick reminder that everything that you might need to access the conference materials and program, you can find them on our ANH Academy website. The link is anh-academy.org/ANH2020. So you might have seen a poll. If you could fill out this poll, it would help us get an idea of how many presentations you were able to watch in advance, just in preparation of the question and answer session. So just indicate whether, how many that you've watched. And we also encourage you to take a look at some of the animations as well to make the most of our live discussion. So before Carol takes the conversation forward, I just have a few technical announcements to ensure that our experience together is as smooth and as interactive as possible. So first, to remember that the session is recorded, and we'll post the session on our ANH Academy website following the conference. So you'll have access to all the materials afterward. Second, all of you as participants have been muted now, but we encourage that you introduce yourselves using the chat function for the Zoom meeting. If you could let us know your name, where you're joining us from, and the organization you work with, it would help us get to know you better. You can access the chat box by clicking the chat button at the bottom of your Zoom screen. And we do encourage too that you share your webcam, but if you prefer not to, use a profile picture. Abel gave us a really useful demonstration of that in the session introduction earlier. We just want to make sure to see your faces. When your video is off, you can do this by right-clicking on your name in the Zoom window and clicking the Add Profile Photo option. Later on in the session, we'll open up the conversation for a Q&A session. If you have questions, share them in the chat box. We'll have somebody monitoring that chat box and then feeding them to our conference chair or to our session chair. If we have time, we'll ask participants to raise their hands so we can call on you so you can speak on your question out loud. If you at any point have any technical issues, first check your audio settings. Then your internet connection. You can always try to reconnect to the session using the exact same Zoom link, so just shut it down and then come right back in. And then if you do have a technical question or technological question, please be sure to send me a private message during the chat box. I'll be monitoring that as well. So thanks so much. Yeah, again, let me know if you have any questions. And other than that, I'll hand it to you, Carol.
Great, thank you, Zach. And thank you to the ANH organizers for the hard work that they've done to make it possible for us to come together, and welcome everybody to the session on political and economic dynamics of nutrition and health, session A. Just make sure this is where you'd like to be. We're glad you've joined us. We have a great group of speakers this morning or evening or afternoon, depending where you're joining us from. We're going to first start looking at some broader sort of systems issues with a presentation by Dr. Andrea Warren. She's a research associate at University of South Carolina with expertise in food security, nutrition, and public health. And she's going to talk about stakeholder engagement strategies for policy and programmatic uptake, lessons from the Drivers of Food Choice Competitive Grants Program. That will be followed by Dr. Nora Lisa Aberman, who is an Associate Research Fellow at the International Food Policy Research Institute. She's an agricultural and resource economist, and she's interested in agriculture and food systems, food policy, gender and value chains, and she'll be talking about leveraging food systems for diets in rural Ghana. And so we have two broader sort of food system economic dynamic talks, and then we're going to have two presentations on results from the Nutrition Seams project. I don't know how many of you were able to join the Learning Lab, but I want to point this out that our last two presentations The first one will be by Ms. Aisha Twibu, who is a consultant for the International Food Policy Research Institute. She was previously based in Malawi. She's currently living in Canada. She's an expert in public health and was the coordinator for an integrated ag nutrition early childhood development program. She'll be sharing results on an economic evaluation of that program in Malawi called NEPI. And then our final presentation will be by Ms. Zhang Tai, who is a research assistant at the International Food Policy Research Institute. And she conducts evaluative research at IFPRI on a number of integrated agriculture, health, and nutrition programs. And she'll share results from a program in Bangladesh applying the SEAMS Nutrition Economic Evaluation Framework, looking at economic costs. So without further ado, I would like to introduce Andrea Warren to give her presentation. Over to you, Andrea. Thank you.
Sure. So yeah, so I'll just give a 3-minute kind of overview and carry forward some of the significance that I wasn't able to cover in the pre-recorded presentation, which hopefully everybody's had a chance to see. So just to give a bit more context, while this particular effort that I presented on is intended to provide guidance on designing and implementing stakeholder engagement strategies and thus focused on describing and cataloging approaches, stakeholder engagement more broadly speaks to research ethics and how stakeholder engagement can lead to a more ethical research enterprise, as well as one that yields return on investment for funders. And so regardless of how a researcher perceives their relationship to the decision-making process, stakeholder engagement promotes the alignment of research questions, methods, and communication strategies with need. And in so doing, it helps to kind of move the research community towards a research model that is more grounded and collaborative and ultimately more innovative. And so building a better practice of stakeholder engagement is particularly vital for multi-sectoral nutrition. Given that the causes and manifestations of malnutrition are so incredibly diverse, and the motivations of all the usual stakeholder suspects, like agriculture, health, education, trade, women's affairs, they may be aligned on one malnutrition issue like micronutrient deficiencies, but they may be at odds on others like obesity prevention. And so the complexity of moving the needle forward on research and policy and practice around all forms of malnutrition is rooted in this challenge of understanding the many landscapes of nutrition in low and middle income countries and identifying entry points for research, which stakeholder engagement, when embedded within a research program, is inherently positioned to address or inform. And so that particular challenge supports the argument, as I suggested in my pre-recorded presentation, for more funding for systematic efforts to both embed and document stakeholder engagement activities and research programs in order to build out stakeholder engagement in nutrition. And furthermore, this type of work has an audience. It falls under the broad heading of dissemination and implementation research and science. And so making stakeholder engagement a more explicit component of research enterprises and using the learnings that are generated from a systematic documentation of engagement efforts to plug into the emerging nutrition, dissemination, and implementation science community can help to refine the points I mentioned earlier, about the role of stakeholder engagement in research ethics and return on investment, moving not towards consensus necessarily, but providing a space for that discussion to play out. Thank you.
Thank you, Andrea. Quick question, organizers. Are we going to take questions at the end of the session for everyone? Zach?
Yes, yes, at the end.
Okay, great. Thank you so much, Andrea. Our next speaker is Nora. Nora, I invite you to take the center stage.
All right, great. And can I share my screen? I have a few slides.
Yes, you can. At the bottom, it's the green button.
And while they're getting that up, a reminder, she'll be speaking about leveraging food systems for diets in rural Ghana.
All right, so screen sharing is currently disabled. I could just talk through if that's better.
Sorry, let me. Okay, can you try now?
Perfect. Okay. Does that look good? Can you see that?
You might want to flip it. We can see your notes.
Uh-huh. Okay. Sorry.
If you exit, you can go to, I believe it's.
Yeah. You know, I think I can just there. Is that good? You can see the.
Yeah, that's great.
It looks good now. Perfect.
It looks great. Yeah.
Thanks. Sorry for the delay. Okay. Thanks a lot. I'm Nora. As you heard in my pre-recorded presentation, hopefully, I'm discussing a mixed methods analysis applying the value chains for nutrition diagnostic tool in rural Ghana, where we looked at sort of compared the north and the south of the country. See, there we go. So we did find food and nutrient gaps in both regions throughout the communities we looked at. Some differences across the communities with pretty similar diet patterns, and a number of highly nutritious preferred foods throughout the communities we went to. So from our market interviews, we found some supply and demand patterns and market opportunities that differed not as we expected by distance to market or kind of how remote the communities were, but rather by the type of market, whether it was a more traditional rural market or a somewhat more urbanized market setting, and the associated supply and demand patterns in those markets. So finally, from our market interviews, we were able to map these highly nutritious preferred foods and their supply and demand patterns to this typology of supply, from low supply, low demand to high demand, high supply, as you can see in this graphic here. And then we can map some sort of high potential food system interventions based on these supply and demand characteristics that we found across these particular foods, and that I described in more detail in my presentation. So here we go. So just a couple of takeaways and implications that I want to highlight that I didn't get to in the bigger presentation. So one is the risks and benefits of very commonly consumed processed foods. So as sort of one result of Ghana's globalizing food system is the availability of processed and packaged foods throughout the country that we find. There's a handful of industrially and traditionally processed foods that are used as kind of a bridge to bridge seasonal gaps in some of the preferred highly nutritious foods when there's a seasonal availability gap. So for instance, traditional processing of chili pepper and industrial processing of imported tomato allows households to consume these nutritious foods that play an important role in the diet throughout the year, even when they're not available. However, on the flip side, there's also high consumption of ultra-processed foods like bouillon cubes that are also used to fill gaps in...
Excuse me if I can jump. I think we can still see your notes, so maybe you can change that part. Sorry about that.
Okay, well, all right, sorry.
If you go to the slideshow tab,
yeah,
at the top where it says slideshow, keep going right, down a bit, yep, just there, and then, oh, you've already got use presenter view off, sorry, that was...
Yeah, no worries. I'm actually in my last sentence, so you can just see that I prepared very well and I wrote down everything, so I didn't miss anything. So, yeah, so, sorry, where was I? Okay, so this, yeah, so the consumption of these highly ultra-processed foods also represents a challenge in diets, but also somewhat something of an opportunity if we can think about locally produced and more nutritious versions that can kind of fill that same gap, that are shelf stable and people can consume, as there's already kind of a preference for these processed foods. So we also find that there's a kind of limited development of domestic supply chains for some of the highly, some of the fresh foods that are highly perishable, and that producers are not really able to take advantage of urban demand or growing urban demand for these foods because of the kind of challenges in the domestic supply chains. So yeah, so things like seasonal supply and demand, short local supply chains, limited infrastructure, these all underlie a kind of preference for subsistence first, rather than a more of a market-oriented approach to production of these foods by these rural producers that could, you know, improve availability so that more people can take advantage of these foods or find them in the markets, and then also that would enhance livelihoods. Okay, so sorry for the technical glitches. I'll practice more next time, but hope that brings you up to speed with my slides. Thanks.
Thank you, Nora. Looks like you were looking at some of the frameworks developed on nutrition-sensitive value chain, which is interesting because the next two presentations will sort of build on nutrition-sensitive value chains by looking at economic evaluations. As I mentioned in in the introduction, for those of you that joined the Learning Lab last week, we'll be presenting results from the Strengthening Economic Evaluation for Multi-Sectoral Nutrition Strategies called Seams Nutrition. And I welcome Aisha to come and give the first presentation based on hers and colleagues' work in Malawi on an early childhood development program. Aisha, over to you.
Thank you. All right, I hope you can all hear me.
Yep.
All right, now to share the video. Some technical glitches again.
Aisha, I just made you the co-host. Is it working now?
Right.
Sorry about that.
Is it working?
Not
yet.
If it is the same slide that you've submitted, I can share it from my end.
No, because they reduced slides now.
Okay.
Can I just send it to you right now and maybe John can go?
Or we can take some questions actually for our first two speakers, because I think it makes more sense maybe for yours to go first. Would that be okay?
Yeah, that's fine.
So why don't we do that? We'll break it up just a little bit for the first two speakers. We do have a question for Andrea on how to navigate and overcome resistance to other barriers to participation from essential stakeholders.
So yeah, I mean, that can be quite challenging. And depending on the essential stakeholders in question, I think, you know, an example from our portfolio with the more resistant stakeholders, or those who maybe had less time to engage, you adapted your engagement style in that case. So let's say with policymakers, there was some resistance among certain groups of policymakers to engage at the beginning of a project before results were obtained. And so the research teams would want to nonetheless, you know, apprise them of the awareness of their project without taking too much time or annoying them or alienating them. And so very brief email communications, very brief in-person meetings just here and there, a light touch approach worked quite well to overcome some resistance, but then you would maybe have other challenges like engaging with the private sector, and perhaps they would see a research project as critical of their operations, in which case that's an open question. That was not a challenge that was easily overcome, and I think one of the remaining questions out of this portfolio and this experience is how to more effectively engage with private sector, because usually there are ways to kind of overcome challenges with the public sector and civil society and the more familiar actors, but it's sort of a newer realm with private sector. So there's a lot more to be learned there.
Great, thank you. If we have resolved the technical issue, we can go to that, or we have just one question for Nora. Abel, or Zach, are we able to show Aisha's presentation, or should I take another question?
I think it's better to take another question.
Okay.
Still waiting for the slides to come to my email.
Wonderful. We have one more question, and these are for the first two presentations. This is for Nora. The question is, you mentioned seasonal limitations to nutritious food supplies. This individual is wondering if you are also observing climate change related limitations. So that's for you, Nora.
Yeah, it's a good question. I mean, this is a cross section. It's one moment in time, so we didn't talk too much about how things have changed. But certainly throughout the 3 years that I was in Ghana, talking about inconsistent weather patterns is kind of at the top of the tongue of all the producers. So we didn't examine exactly what the implications are for these nutritious foods, but certainly it's a challenge, and actually to delve in particularly to how it's affecting these, the leafy greens that people enjoy, some of the fruits that people enjoy. I think that would be an interesting next step. Great.
And I have a question for Andrea. Have you ever brought stakeholders together around a program or an interventions program impact pathway? So using a common framework. And if you have, could you share that with folks right now?
So personally, no. And as far as the grantees in the DFC portfolio went, some of them were working with program impact pathways that they had developed perhaps for larger projects that their DFC work was a follow-on to. And so that made an appearance in their stakeholder engagement strategies for this particular piece of work. But I'm not sure that I can share too much insight on bringing people together for that purpose.
Okay.
Good question.
Okay. Okay. All right, checking in on are we ready to launch those slides? I have another question. If not, I'm always prepared.
Let's go, and the slides will be ready.
Okay, great. So this question is for you, Nora, and wondering how are you using the information that you've obtained from your food systems work in Ghana? If you've used that sort of nutrition sensitive framework, you've looked at those various issues by that matrix that you shared with us, and wondering what would be some of the recommendations based on that research?
Yeah, sure. I mean, it's sort of two levels of recommendations. The first was really reflecting on the focus of agriculture policy right now. It's really a focus on, I mean, right now, of course, everything is sort of upended this year, so it's a little bit hard to say, but certainly at the time of the research, the discourse was really around agricultural transformation, in industrial processing, and how do we, import substitution. And one of the kind of key themes that I think came up out of this is that if we have a more a localized view of supply chain, value chain development, where you look at a particular urban area and you have some producers that are particularly well suited to producing a particular set of foods, and we're not only thinking about maize and rice, but we're also thinking about, and not only kind of cabbage and carrots that you sell to hotels, but also the ones that people eat at home, and you incorporate that into infrastructure development, new technologies for storing, packaging, and that sort of thing, I think that can have really successful kind of major effects for those micro food systems within a particular area, rather than this very broad nationwide, we have Planting for Food and Jobs, where it's a set of a short list of cereals and vegetables that are supported broadly regardless of kind of where you are.
So that's great, thank you, because I think what you're highlighting is how local food systems are. I think just to bring it back to Andrea's presentation about the importance of engaging the private sector as part of those conversations. And so maybe that makes the job a little easier if you think about stakeholder engagement at that local level. So both really nice presentations. I think they're super complimentary. Abel, are we able to shift to the next two presentations, or I can check for any other questions? I invite questions from participants.
No, I can share the slides now.
Great. We will take more questions for Andrea and Nora, but now we'll shift to the next two presentations on results from SEAMS Nutrition, starting with Aisha Twibu. Aisha?
Thank you. First slide, please.
Is that the second slide?
Yeah.
Okay.
All right. Hi, everyone. Sorry for the technical glitches. As Carol has introduced, I'll be presenting some of the work from the SEAMS approach. And this is the work that was done in Malawi, an economic evaluation of an early childhood development center-based agriculture and nutrition intervention. Next slide, please. Heather, next slide, please. All right. Our study objectives were to estimate the intervention cost, to understand the cost effectiveness of this intervention, as well as to calculate the return on the investment of the intervention. All right. So this work was actually, which applied the SEAMS approach. It applied it retrospectively to the Nutrition Embedded Evaluation Program Impact Evaluation, or NEEP study. The NEEP study was a randomized controlled trial that was supported by Save the Children in Malawi, and the intervention activities included agriculture inputs as well as trainings. The idea was that this would actually improve the diets, the nutrition, as well as the development of young children. This is between the ages of 3 to 6 years old that were attending preschools. Next slide, please. So now in this slide, we actually see how we applied this SEAMS nutrition work. You have to go back, sorry. All right, which allows us to actually break the cost by input as well as by activity. On my left there, you see that the cost by input, the back of the costs were actually personnel. This was about at 40%. And at 16%, we actually had supplies such as farm inputs. On my right, looking at the cost by activity, which also shows us some of the drivers of the cost, we see that trainings were actually almost at 50%, which does make sense for this kind of intervention because, as you heard earlier, most of the interventions actually centered around trainings. But also the school meals, which were provided by the communities, were at 16%. Again, this highlights the importance of communities in contributing to these interventions. Next slide, please. All right, now in this slide, we see the results from the economic evaluation. That's for both the cost efficiency, cost effectiveness, as well as the benefit cost analysis. The total cost of this program was estimated to be almost $200,000 US, And when you look at this, you look at that, the preschool children that were reached, that was about $194 per child, or that translates to $41 per beneficiary, or $219 per household. Looking at the cost effectiveness, we see that the intervention was able to evade over 300 cases, stunting cases that is, which translates into 516 disability adjusted life years evaded. Now on the last one, looking at the benefit cost analysis, we see that for each dollar that was invested in this program, the community was able to derive $3 from it. And that is the end of this presentation. Thank you very much.
Thank you, Aisha, for briefly summarizing the results of your program. We'll now shift to the final presentation by Zhang Tai, and she will be presenting applying the same SEAMS nutrition framework to a cost study in Bangladesh. Over to you, Zhang.
Thank you. I will try to share my screen as well. Oh, sorry. Can you all see it?
Yes, we can see it. Thank you.
Okay. Hi, everyone. Thank you, Carol, for the introduction. So I will talk briefly about how we apply the SEAMS nutrition framework to our program in Bangladesh, and then just touch base a little bit on the results, and then how we compare this program with NIPI, which Aisha just presented. So this is a study on the economic costs of a multi-sectoral nutrition intervention implemented through a credit platform in Bangladesh. And as Carol mentioned, we apply SEAMS nutrition framework to our program. I will talk in detail about the framework. You can refer to the recorded videos for more details. But as I mentioned, we apply the SEAMS nutrition framework to targeting and realigning agriculture to improve nutrition or trade in Bangladesh. So this is an ongoing project that aims to tackle the high prevalence of undernutrition among women and children in rural Bangladesh. And you can see here, there are 4 arms in total, and they all built on an existing credit platform that ran by BRAC, our implementing partner in Bangladesh. And so arm 1 is a control arm that only has a microfinance program. 2, 3, and 4 are the treatment arms that built on each other with added components. Like arm 2 has the nutrition BCC, arm 3 has the added components of the agriculture, and then arm 4 has the added component of gender sensitization activities. So just very brief on our results. Just to remind you, if you haven't watched the pre-recorded video. So the total incremental cost of the train program was $522,000 US for the period of the first 6 months of the program, plus the 2 full years of program implementation. This is equivalent to $138 per household. This is US dollars, or $74 per beneficiaries. And then when we break down the cost by input, the main cost drivers are the personnel and the travel allowances, because train's interventions relied heavily on frontline workers to deliver the messages to households. And then when we look into the costs by activities, our main cost drivers come from home visits, site supervision, and community events. Again, this is the main platform that train interventions were delivered to our beneficiaries. And then when we break down the cost by treatment arm, as you can see here, as the program complexity increases, we also see the unit cost per household also increase. It increased from arm 2, which is $83 US per household, to arm 4, $191 US in arm 4. Sorry, before was arm 2. So now I think I'm going to talk more a little bit about how we compare our cost profile with NIPI that Aisha just presented. So we see a striking similarity when we break down the total cost by pathways. For both programs, they are both integrated agriculture and nutrition interventions, and both programs has more than 50% of the total cost that come from increasing demand for nutritious food activities. And then a quarter of the total cost come from increasing supplied activities, and then 20% of the total cost come from enabling environment activities. So this is an advantage of the SIMS nutrition framework, is that it allows us to be able to compare across programs that have a similar approach. Yeah, so I think that's it. Thank you.
Thank you. Thank you very much. Okay, well, great presentations. Thanks to all of our speakers. We've answered a couple of the questions now, and we have a few more questions for, please keep your questions coming in, and we'll shift to, the first question is for Aisha. And I'm not sure, let's see. The question is, how do you explain that you did not observe a change in early learning outcomes? And I think that's from the presentation. So Aisha, if you can take that question.
All right. Okay, thanks, Carol. I think to answer that, I'll partly answer it and then I'll ask Paulo, who is also joining us, to add to that. So this intervention that we talked about was implemented only within 12 months. So that was 1 year. So looking at the issue of early learning, that's something that might actually take a little longer to actually see the desired effects that we might have wanted. So that was probably one of the reasons why there wasn't a change in the early learning outcomes for the preschoolers. But as mentioned in the pre-recorded video, you'd notice that there was actually some sort of a spillover effect, in that there was linear growth actually among the young siblings. So I guess that's something to look at as a positive thing.
Great. And then another question for Aisha, but if Aulo is on the line, or I can take the question, sorry, give me a minute. The question is, sorry, the questions are shifting as we're speaking. Give me a minute. Oh, you mentioned that death averted was one of the measured benefits. Can you describe the methods you used to calculate death averted? So let me see if Aulo wants to answer that. If not, I will. Aulo, are you able to unmute?
Sure. Can you hear me?
Yes, thank you. Welcome,
Wonderful.
Aulo.
Thanks so much. Thanks so much for the wonderful presentation. So, Aisha, I'll just jump in and complete the answer to the earlier question as well. We did look at child development outcomes in both the preschoolers and the younger siblings. It's important to bear in mind that the control group actually had the basic early childhood development package. So what we were testing was, does the addition of behavior change on nutrition and agriculture change diets, and does that change in diets then result in early childhood development outcome improvement? And we didn't see anything in the preschoolers in terms of the returns or the impacts after 1 year. But as Aisha mentioned, we did see changes in linear growth in the younger siblings after a year. And when we went back after another year, we found that the children that had grown taller had higher child development scores, both in aggregate and across 3 of the 4 subdomains that we tested, really showing the plausibility of these impacts. In terms of the question on deaths averted, what we did was really feed the data from the randomized trial into the lives saved modeling tool that was developed by Johns Hopkins that gives you estimates of deaths averted. So those were essentially parameters that we fed into the model, and that reported back in terms of the actual absolute numbers of deaths averted.
And perhaps it's useful to say, Aulo, that though you fed information on reductions in stunting that were a result of your program, correct? So you had to have that
exactly
change.
Thank you.
And then the list tool then uses effect sizes to convert that into deaths averted. Is that fair to say?
Thank you. Perfect. Yes, exactly. Thank you.
Another question, for those of you that actually are looking at impacts on stunting in your effectiveness studies, LIST is a super useful model to take your own results and plug them into your into models that have been developed for your own country, even subnational models. And what Aulo and his team did was reach out to Johns Hopkins University, and they typically, if you write to them and ask, they will send you the LIST model either at the national level or the subnational level for entering your own impact studies if you want to calculate deaths averted. So just a heads up on that resource. The last question we have is for Zhang or Aisha or myself or Aulo. Actually, it's a question on how researchers can make use and adapt the SEAMS nutrition project tools for their own needs. Thank you so much for that question. I would recommend that you get in touch with any of us, myself, Aisha or Zhang, and we will send you access to the set of tools. We are also working on developing a guidance document that should be available by the end of the year, we hope. It's a little bit of a work in progress, but the tools are certainly available, and we're available to help you apply them to your own projects. So are there any other questions? I'm not seeing any. Well, if not, this session, and what time does this session end, Abel?
It will end now, but if there is anyone maybe who wants to ask a question using the audio function, they can raise their hands and we can unmute them. We have like 2-3 minutes.
Okay. Well, if no other questions, I'd like to thank everyone for joining us wherever you are in the world. Thank you to the presenters for giving really great, succinct presentations. I encourage everyone to watch the longer videos. They were terrific. So.
Thank you, everyone. We'll close the session now. Again, all of the materials are posted on our website as well as the longer presentations. We'll see you in future sessions. Thanks.
Thank you. Bye-bye.